Wow. I am so proud and privileged to be an osteopathic physician. And a day like today gives me pause to think about all those individuals that have influenced me over the years to allow me to get to this point today. Now, I've been around for a pretty good number of years, so I'm going to limit my thanks to just my osteopathic influencers. First, my mom and dad, who instilled in me integrity, honesty, respect, and a love of God. Those values have never failed me in anything that I have done. And I thank Don Polk and Mike Whiting for serving as my MC and for presenting that inspirational invocation. You are two stalwart members of our profession. Thank you for what you did. There are two individuals that I must thank individually because without them, I would not be here today. David G. Doan, MD, served in the Navy during the Korean conflict and then went into practice in upstate New York. A son of his, Stephen, attended West Point, and upon graduation was commissioned as a second lieutenant in the United States Army Infantry and was deployed to the Republic of Vietnam. And in the performance of his duties there, he was killed in action. But for those actions that he was performing that day, he was awarded this nation's highest military honor, the Medal of Honor. And when Dr. Doan was invited to President Nixon's White House to accept his posthumous award, the president asked him, "Is there anything I can do for you?" And Dr. Doan told him that he would like to get out of private practice and to rejoin the armed services. So he was commissioned in the United States Army Medical Department and very shortly became the first family medicine consultant to the Army Surgeon General. And his task at that time was to implement, integrate, and establish family medicine in the United States Army Medical Department. And I happened to be assigned to that consultants division as an administrative officer at the time. And I was working directly with Dr. Doan in getting family medicine established in the Army. And we became friends, and then he became my mentor. He was aware of my latent desire to become a physician that I had, for all intents and purposes, given up on. But through his influence, his support, and continuing to support me to take that risk, and through his direct influence, I was given an interview at the Kansas City College of Osteopathic Medicine and was accepted for admission to the school. I would not be here today were it not for Dave and Margie. And Dr. Burns and Dr. Mayo, I personally want to thank you for having the vision, the stamina, and the fortitude to refocus your efforts on the reorganization of our association. Your efforts will be realized throughout the upcoming years. Thank you from all of our osteopathic physicians to you. And of course, I would like to thank the AOA past presidents, my fellow trustees that I served with on the Board of Trustees for the past 14 years for your advice and encouragement and what you do for this profession. I need to recognize my state affiliate society, the Tennessee Osteopathic Medical Association, TOMA, for supporting me and supporting the citizens and the fellow osteopathic physicians of Tennessee. And I must recognize our AOA staff. Dr. Clower has put together a remarkable team. They are true to our profession. They are experts in what they do, and they really provide support for us. And lastly, but certainly not least, I must thank my wife, Donna, who for the past 25 years has stood by my side, supporting me in my efforts with the AOA. She is an excellent confidant and a wise advisor. She truly is the wind beneath my wings. I love you, Donna, and thank you. This is a unique, remarkable time of our lives, both professionally and personally. And the elephant in the room, as past President Vin would say, is COVID-19. We have been existing within this pandemic. We are attempting to learn how to practice and survive in this pandemic, and we must learn how to get out of this pandemic. And now, associated with this pandemic, is the recognition of years and years of unmet social needs in this country. Now, the AOA has always embraced diversity and inclusion and the unqualified value placed on human life. And our profession has a long-standing commitment to addressing health disparities. We will continue to address this. But for the immediate future, and probably most of this upcoming year, these entities will be omnipresent. We will deal with them as we need to, but we must continue our mission. My challenge will be how to learn to govern virtually. That's not the way that I normally do it, but we shall. Nonetheless, we must position and strengthen our association as a medical, physician-led professional society in this country. We currently represent about 25% of the osteopathic medical students, but only about 13% of the physicians in practice. But by the end of this decade, we are projected to represent 20% of the practicing physicians in this country. So we must continue to enhance and set the standards for continuing medical education, AOA board certification, but most importantly, the provision of accessible, appropriate medical care for the citizens of the United States, our patients. Now, to move us forward, one of my prime focuses this year will be to expand our osteopathic profession. And by that, I mean I want every osteopathic physician, practicing or retired, every osteopathic medical student, every postgraduate trainee, every physician in practice to belong to their specialty societies, their state societies, and our national association. Not for financial reasons, but so that I, as your president, representing osteopathic medicine, when I speak, I will be truly representing the almost 128,000 osteopathic physicians and 38,000 osteopathic medical students. So when I'm speaking to perhaps a senator, a congressman, a mayor, a patient, somebody that calls, I will be truly representing the entire entity of our profession. So I am going to direct a focus on membership. We also need to support the future of our profession. Membership begins with students. And when I think of students, I think very fondly just to this past May, when I had the distinct privilege and honor of addressing the graduating class from the Rocky Vista University College of Osteopathic Medicine. Now, unfortunately, that had to be a virtual presentation. But as I sat in front of my computer looking at Zoom, I began to envision the faces of those graduates and the pride that had to be on their face at that moment of achieving this first lifetime ambition of theirs. I am, by nature, a joiner, so I had no compunction to ever not join the association, the professional association that was going to represent me for the rest of my professional life, or the affiliate society that would be representing me at that time, in which, since I was joining the Army again, was the Association of the Military Osteopathic Physicians and Surgeons. So I joined the AOA and AMOPS. And throughout the years, that's what I have done. And that's what you do. We need to ensure the continuance of our profession. We need to enhance our profession. We no longer are fighting for equality. We no longer are fighting to prove our competence. We are. You know that. I know that. Everyone needs to know that. I want you to be proud. You asked to be osteopathic physicians. You became osteopathic physicians. We are osteopathic physicians. We must maintain our distinctiveness. We must engender loyalty and pride in our profession. And to do what we must do, we must do it together. Now, it is now my responsibility to ensure continuity in our leadership, to ensure that the initiatives of our immediate past presidents are taken to completion and integrated into what we do. Dr. Mayo focused on membership value. Dr. Burns on membership services. Of course, I will continue to support those initiatives and build on them. Dr. Mayo and Dr. Burns also focused on expanding innovations in continuing medical education and AOA board certification. But COVID-19 forced us to rethink what we could plan to do to enact innovations in the future to what we had to do to realign and to establish now. Because the future is now. Now, we will continue to monitor the single GME accreditation system. Our osteopathic student graduates wanted to be ensured that they would have the opportunity to compete for and get into the best quality postgraduate training programs that they could. And we have now guaranteed that. But what they additionally want is for those quality programs to have incorporated into the training osteopathic recognition. They want our osteopathic principles and philosophy incorporated into their postgraduate training. So another of my initiatives will be to support more, and more osteopathic recognition into these residencies. We will work on that. We will continue the aggressive support that we are now giving to our affiliate societies, state and specialty. We will continue our open, honest communication with our students, our postgraduate trainees, our new physicians in practice, and all DOs, members and non-members. If we don't communicate to the non-members, how are they going to have a clue about what we are doing for them? Why would they want to join something they don't know about? So that will be another emphasis of mine. And we as an organization will continue to provide and support the things that you desire and need. I need your help. I want you to join with us in achieving these objectives. I want you all to be membership ambassadors. If you know of osteopathic physicians in your practice or in your hospital, or students that you may encounter, or residents that you may encounter, ask them, are they a member of their specialty society? Are they a member of their state association? Are they a member of our national association? And if not, ask them why. Encourage them to give us a 2-year try. I want them to join for 2 years so they can participate and be part of the direction that this profession is taking. I need your help. In closing, I would like to quote William Jennings Bryan, a statesman from many years ago, who said, "Destiny is no matter of chance. It is a matter of choice. It is not a thing to be waited for. It is a thing to be achieved." And we all, working together, have the choice to move this profession forward, to demonstrate to the world what we do, to do it better, and to reinstill that great pride of being an osteopathic physician.